Hi there. So you've probably heard about dry eye disease, but what exactly is it and what sort of things can you do to make it better? Hi, I'm Dr. Alexander McKeen and I'm with Cedar Pointe Optometry to help answer those questions. The simplest explanation is that dry eye is a chronic condition where the tear film becomes unstable. In other words, the very thin layer of water on the eye surface breaks apart very quickly between blinks, and this can irritate the eye in a variety of ways. Early on, there's often very few symptoms, if any at all, but over time this can actually progress and get to the point where the eyes feel very red and scratchy and inflamed, and there may even seem to be a film over the eyes because your vision's constantly coming and going. Ironically, one of the earliest signs of dry eye is excessive tearing. Now, I know that sounds counterintuitive because I just said that the eyes are dry. So how can they be watering? Well, this is actually a defense mechanism the eye uses to overcompensate for poor tear film by flooding itself with more water than it actually needs. However, if it gets to the point where the eye isn't able to produce enough water to keep itself fully lubricated, eventually you will begin to feel those other symptoms I mentioned, such as burning, stinging, scratchiness, grittiness. And in a lot of cases, people often say, "It feels like there's something stuck in my eye." See, the reason we start to feel the dryness is because the clear central surface of the eye, called the cornea, is filled with many small and highly sensitive nerves that become agitated when the properties of the tear film change or when they're exposed to the atmosphere. The day-to-day symptoms aren't usually consistent. For most people, they actually fluctuate at different times of the day or even year, depending on a bunch of factors, such as the subject's health, their environment, and of course, what they're doing in the moment. One of the biggest contributors to dry eye is excessive screen time. When we're looking at a TV or computer monitor, our brains are programmed to not blink as much. A quarter as often, to be precise. Blinking less often means less tear production and distribution. So if you stare at something for too long, you are basically going to induce an acute episode of dry eye. This is why people who stay up all night working on their computers or playing video games get bloodshot eyes and complain their eyes feel tired the next day. It used to be that dry eye was something predominantly seen in middle-aged and older females, but thanks to phones and monitors becoming such an integral part of daily life, dry eye has become increasingly prevalent in both genders and even showing up in people as young as teenagers now. All that said, it's important to realize that screen time is only one specific piece of the puzzle. The reality is, dry eye is a lot more complicated than that. Like, a lot more. In fact, there's a whole categorized list of different types of dry eye, each with their own sub-list of potential contributing factors. And heads up, most people with moderate to severe dry eye actually have multiple types going on at the same time. It's all possible that the tear gland can't produce enough water, the eyelids don't produce enough oils or can't close all the way, there's too much surface inflammation, the corneal nerves aren't doing their jobs properly, there's a problem with diet or hygiene, or something's getting into the eye that shouldn't be there. Those are all pretty vague. So if you want to know more about these different categories, I'm going to create another video in the future where I go into much more detail with each. The point is this. Without going into an in-depth evaluation or proper workup, it's difficult to know exactly why you specifically have dry eye, because no two people with dry eye are exactly the same. There's simply too many potential combinations of causes. So the best treatment for dry eye completely depends on which categories you fall into and what factors in your life are putting you there. The good news is there are plenty of new and emerging therapies available to help take better care of our ocular surface and minimize or even eliminate dry eye symptoms completely. There are lubricating eye drops and ointments, heat compression therapy, blinking exercises, tea tree oil application, punctal plugs, specialty contact lenses, medication to upregulate tear production, reduce surface inflammation, change the way our eyelids produce oils, and there are even several in-office procedures that can help to unplug these important oil-producing meibomian glands by using a combination of light and or heat and or eyelid manipulation. I know that sounds like a lot, but again, I'm summarizing, and you don't have to do them all, but the trick is that not all of these treatments are applicable to everyone with dry eye. It really depends on what specific types of dry eye you have. A good start for anyone suffering from dry eye is to start taking some artificial tear supplements at least once a day or more as needed. Specifically look for the words preservative-free on the box or bottle, as these are much better for you in the long run compared to their preserved counterparts. If you're already doing this and you feel like your symptoms persist or your drops aren't helping very much, I highly advise you book an appointment specifically to deal with your dry eye. Now, when it comes to your annual routine eye exam, your optometrist will be happy to provide you with some extra tips or tricks you can try at home. But because we're generally busy checking your vision, how your eyes work together, if your glasses need to change, and the health of the back of your eyes, there's almost never enough time to really dive into dry eye as deeply as we like to or need to get the full picture. Here at Cedar Pointe Optometry, we offer comprehensive dry eye consultations where we use special equipment not found at all optometric offices to look at the condition of your meibomian glands, how much tears your eyes are able to produce, and evaluate the quality of those tears. These test results, combined with an extensive lifestyle questionnaire and ocular surface evaluation, will help your doctor to determine exactly which categories of dry eye you fall into. That way we can develop a personalized management strategy that works best for you and your version of dry eye. Well, I hope you found this video helpful and informative. Again, I'm Dr. Alexander McKeen. Thank you for listening, and I'll see you at the next video.